The other stroke is called sawing friction. Sawing friction can also be done anywhere, but I'll tell you it's fantastic for shoulder blade work. When you have your client up in the what we call chicken wing position here, so you're working with their shoulder blades, you sink your hands and you friction back and forth, and it gets hot on the body. And you've got to move your body too as a therapist, or you will get tired doing this stroke. Look how red your patient's back gets. This is a very heating stroke, breaks up adhesions really well around the joint spaces, and it really warms the tissues. The other one that I'd like for you to remember to do is a raking technique, raking through the rib cage, and it would be considered a friction move. You basically lock your fingers like a claw or an old-fashioned rake right under the rib cage, and you rake in between those intercostals. And this feels good on both sides of the body. It's absolutely wonderful. And it's a technique that most therapists forget to use. We spoke about vibration earlier on the feet and on the leg area. You can do a one-handed vibration. It's a fine tremorous movement, 600 oscillations. One-handed, or you can do two-handed. You can see the client has a little bit of goosebumps taking place. You're stimulating them. That's good. Your nerve strokes are your finishing strokes. So one-handed, two-handed, and as I said before, on the extremities you could do that shaking, that jostling motion. And that's very, very good. One of the strokes that I did forget into the friction is called thumb rolling. And this is a technique that is done with neuromuscular therapy. However, it comes from the family of the Swedish strokes. And it's very important that you don't have a lot of oil on your client. Some of your strokes can be done dry. This is one of them. Especially if you have a person that is very hard, tight, real stiff muscles, and you need to loosen them up. But I will tell you it is a very painful technique, especially if the connective tissue is just what we say locked. But you will be able to free up with this particular stroke. She doesn't have a lot of oil. I'm a person that doesn't take a lot of oil when I massage. You just have enough for a slide. So I believe she'll be fine. And you take your fingers and you do what we call a crawling method. And as you can see, if the camera wants to come in a little closer, you're picking up the skin and you're rolling it. I think of it like a steamroller. And I'll tell you, some clients, they don't like this because the tissues are so tight, especially when you start to get into the lower back. As you can see how I'm really pulling up the tissue. And the beautiful thing about skin rolling, you can do it in all different directions. it will break up and move tissue around like you need it to. But it is not a fun treatment. You'll see that certain patients have different pain thresholds. My particular client on the table has a very high pain threshold. She's not even squirming on me. And you'll have some of your patients just kind of squirm under your hands. And you check in with them, because this is not about hurting a patient. This is about helping. And earlier, where she was locked a little bit right there, I'm going to really open that up for her. And that's the beautiful thing about skin rolling. It can be in all different directions.